Today, I will be discussing the prevalence of childhood asthma among females of low socioeconomic status in Long Beach from 2005 to 2015. First of all, what is asthma? According to the American Lung Association, asthma is a lung disease that makes it harder for someone to move air in and out of the lungs. People with asthma have hypersensitive airways, meaning that they react to things that may not bother other people. For a person without asthma, their airways is pink and clear, with no swelling on the inside, and there is no mucus overproduction that the airway is able to move freely through the open airways. But for someone who has poor or uncontrolled asthma, there is always inflammation. Even when you are not experiencing symptoms, the inflammation is still there. The inflammation makes makes the airways red and irritated and swollen. When the tissue is inflamed, the airway is narrow and the airflow is decreased. Next is the agents of the disease. No one really knows what causes asthma. It tends to run in families and may be inherited, and environmental factors may play a key role. According to the American Lung Association, there are four main theories as to why asthma develops. The first being genetics, then allergies, then respiratory infections, as well as the environment people live in. The first cause researchers found to cause asthma is genetics. If a child's parents were diagnosed with asthma, then the chances of that child having asthma increases significantly. Second cause as to why asthma develops is allergies. There are many allergies that will trigger asthma. Some people are more likely to develop allergies than others, especially if one or both of parents has allergies. Some of the substances that may trigger asthma symptoms and signs are pollen, dust mites, and pet dander. In some people, skin or food allergy can cause asthma symptoms as well. This type of asthma is called allergic asthma or allergy-induced asthma. Next is respiratory infections. As the lungs develop in an infancy and early childhood, certain respiratory infections have been shown to cause inflammation and damage to the lungs. The damage that is caused in infancy and early childhood can impact lung function in long term. Lastly is the environment people live in. Contact with allergen, certain irritants, or exposure to viral infection as an infant or in early childhood when the immune system isn't fully mature have been linked to developing of asthma.